states. Now let's take a look at the global situation. Fred Smith is head of our health desk. He's joining us via Zoom with the global outlook. Fred, tell us what we should know as far as the global outlook is concerned.
Well, the cases we have around the world have currently increased past the 5 million mark. And if you look at the United States, for instance, they have more than 1.5 million cases. It's followed by Russia with more than 326,000 cases, Brazil with 310. So in terms of top three, these are the countries. And then in terms of countries with the number of deaths, you still have the United States leading that, and many of the states in the United States are leading in terms of the deaths. Looking at what's happening around the world, in Brazil, for instance, where we have the world's second highest number of cases, their deaths have surpassed 20,000, and they have more than 20,000 cases. And then in China, everything is back to business because, if you recall, Congress was delayed, and it's as a result of this resurgence of coronavirus cases. And then in Spain, we know that they are also easing the restrictions there. Whilst in the Middle East, we know that 10,000 Iran medical professionals have also tested positive for it. And that's in terms of the world, what's happening. But Gifty, I'll tell you what, Ghana and other African countries are seeing slow in the number of cases they are recording on a daily basis. However, we need to be very concerned about Nigeria for the West African sub-region. As we speak, Nigeria, with 7,016 cases, they have as many as 211 deaths, and that's very alarming. That's out of the 578 total for the sub-region. Nigeria alone with 211, Gifty.
And Fred, in terms of recoveries, is there any good news to, point to?
Well, indeed, we're having more than 10,000 recoveries in the West African sub-region. That's out of the total of 27,000 cases that we have, 10,000 recoveries so far. And we also have 16,162 cases that are still active, Gifty.
Well, Fred, thank you very much. But do we have any information as far as, your sources are concerned with Ghana's situation? It's been a while.
Yes, indeed. Ghana's cases continue to climb, but on a slow scale because we have been able to clear the backlog. And so the number of cases that we'll be hearing going forward will be reducing. Even though we still record cases, it will be on a declining scale.
And so, having said that, I refer you to what Albert Sori told us from the Upper East today when we went on the regional. We went connected with the regional correspondent. He said that for the past about 2 weeks, he wasn't so sure, I must say. For about 2 weeks, they've been at 26. The Upper East region looks to me like something good has been done in the Upper East region. Bono has had one case for some time, and it stayed that way. But then the correspondent also says that people are not really adhering to the protocols in some places. I get the inclination that perhaps we need to conduct some more tests there. I don't know how you see this scenario.
Well, I think that the more tests that we conduct, the more cases that we will be able to find. And so as the contact tracers continue to look for persons who may have been exposed, we're likely to get some more cases. But as I said earlier, it's not likely as high as we've had in the past.
And what do you think about the central region and the western region? They're seeing some real quick jumps there. Natalia reported about how the numbers keeps increasing, especially in the western region, which didn't have a case as at when the epicenters, Accra and the Ashanti region, had a lot of cases. What are your thoughts on that as well, Fred?
Well, Gifty, the lockdown was lifted some weeks ago and people continue to move. And so if persons who've been exposed in, say, Greater Accra region and have moved to the central region, they're likely to spread over there. and the lifting of the restriction mainly may account for rising cases in some of these areas. But of course, it's also not clear how people are moving, and we would expect that maybe once we have the lockdown lifted, we'll be able to conduct some more contact tracing and enforce the measures that were announced by the president in his previous messages.
Well, Fred, thank you very much, and I hope you're having fun, you're taking care of yourself and staying safe.
Yes, I am, Gifty. I hope you are too.
As you can see. Fred Smith is head of our health desk here. He's also producer for the show, lead producer for the show, I must say. He joins us from home as he takes a look at the global picture and helps us with a bit of analysis on the situation that our correspondent reported on.